then you can introduce yourself and hit the presentation. So I'm Mark Kleinschmidt, President, CEO here at the Chamber. Uh, I've been here since 2018, so it's been a while now. And Amy, you go next, and then Brooke, then we'll go to Jill and Ben.
Amy Berry with the Chamber. We just were talking about that. I've been here since 2019.
And then Brooke.
And I'm Brooke with the Chamber of Commerce, and I just started in February. I'm happy to be here.
So, all right, Jill.
Hi, Eric, and hi, team at the Chamber. This is Jill Porter. I work at Arundel Economic Development Corporation, and I am driving right now, but eventually I'll be able to come back on camera once I'm finished this drive.
All right, no margaritas for you, definitely. All right, Ben.
Hello, Ben Crozier with ICSI. Been here about 14 months and been an ambassador of the chamber for the last couple months. So that's me.
So, all right. So Eric, that's our group. Let me turn it over to you. Tell us a little bit
Great.
about yourself and give us the Uneo Health.
All right. Mark, thank you and the Chamber for letting me present today on this. I mean, May is Mental Health Awareness Month, as probably most of you know, so it's a very timely presentation. A little bit about myself. So I live in Anne Arundel County, have for majority of my life, spent about 35 years in the healthcare technology sector. Worked at some large corporations, Care First and other companies, and then most recently during COVID started Uneo Health. And so today we're really going to focus on mental wellness and workplace, and just really hopefully put some data points and some ideas on people's minds that maybe we're not thinking about. There's a lot going on, obviously, with tariffs and everything else, but I think it's a good time to speak about kind of the role that mental health plays in the workplace. For Uneo Health, and people pronounce it many different ways, but Uneo is kind of how we go. We were founded 3 years ago, in like I said, in Anne Arundel County. Co-founded by my son, who's our CTO, computer scientist who went to NYU and actually Anne Arundel Community College, got his comp sci degree as well. Our goal was to make self-care accessible, but during COVID, and a couple of years before that, both of us had experienced a number of people in our families that and friends. My son's one of his best friends took his own life from opioid overuse and struggled with a lot of mental health challenges. And I lost three of my three cousins and my mom to mental health issues and opioid issues and suicide. So we really wanted to do something different, try to get people thinking about proactively about their mental health, so they're not going to go to the ER, not going to end up in a crisis mode. So that was why we launched Prosper. And I'll talk a little bit about this in the second half of the presentation. But Prosper is a self-care app. It's on both app stores, Apple and Google. And when we launched, we started working with Anne Arundel County Mental Health Agency and Health Department. We then brought in partners that were really, the goal was, can we find constituent stakeholders, businesses, organizations that had a population that they wanted to work on their mental health, on their self-care, on their wellness, and keep Prosper self-care app free and private. We don't collect any information like name and address up front, but then they can use it to kind of spearhead their wellness program. So working with Johns Hopkins, Pediatric Diabetes Center, National Alliance on Mental Illness, the state of Maryland, the Maryland Community Health Resources Commission, several other clinics and some employers now as well. So that's kind of our organization, but we have a great partnership of a lot of national and regional universities, mental health and behavioral health related groups to kind of support how the app is built, the content that's in it, and kind of how we approach. There we go. All right, so I'm going to put some numbers out there for folks. I think that unless you're like I spent my entire career in the healthcare space. I worked at Anne Arundel Medical Center when it was in Annapolis, eons ago. And so, but for most people, we know about mental health just from family or friends or ourselves. And but don't realize just how prevalent it is, right? And how it impacts as employers and the folks that are as part of the chamber, and we're all employers. I'm an employer. The impact that it has on ourselves and our employees is significant. About 1 out of 3 adults, have some type of mental health challenge, and far higher percent have other aspects of mental health challenges, just kind of one-off panic attack, things like that. But 20% of folks have anxiety. Depression is almost 1 in 10. Bipolar disorders, PTSD, eating disorders, which is a smaller number, but it's also more prevalent in younger folks, and then substance use disorder or substance misuse, 10%. I think that, and that includes when you look at alcohol, things like that. So there's a lot of mental health issues. Problem gambling as an addiction is a mental health issue. We're working with Maryland Problem Gambling Center as well. But these all are, forces. They're things that our employees carry into work with them, right? And it's not just about them, right? They, especially for older employees that have a spouse, have children. I have 2 grown children now, and my kids both struggled a lot with these, and that impacted me at work. That impacted my ability to focus, my ability to deliver, to my employer, the things that were going on at home, right? And so I think it's important if the employers that listen to this webinar that are here today that get anything out of it, is just to be more mindful that these are things that most of your employees are experiencing, and are you empowering them with the right tools to deal with it? Because we all deal with stress, anxiety, and some people have much more intense issues like depression or addictions that can have a super big impact on their ability to be productive and to stay as an employee. When you look at the workplace, and Mark, I didn't mention in the beginning, if folks have any questions, they can jump in. I really want this to be a conversation. We don't have to hold them to the end. But
Yeah, or if anybody wants to throw it in the chat too, we'll monitor that. So, because it's good to make it interactive. So it's good.
Yeah. It's always better to answer a question as it's going, as opposed to like trying to remember 25 minutes ago what I was talking about. But just when you think about the workplace experience itself, whereas about 1/3 of folks have a clinically defined diagnosis of an addiction, a mental health issue, anxiety, stress, depression, bipolar, etc. For a higher percent have symptoms relating to those conditions. So whether it's a panic attack, whether it's just dealing with anxiety because they just lost a parent, or their child is, one of my children went to the ER for a very significant issue when she was in high school, and those things weigh on our employees' minds, right? So it's a lot of our employees are going to be facing this, and again, we just want to be mindful. Do we have the right tools? Do we have the right training of our management staff for that? Mental health it's much more spoken about, right? Since COVID, we all know that this is something people talk far more openly about. Before COVID, not only do we not do video webinars and all of our conference calls at work, but we also, we didn't talk openly about mental health issues anywhere near as much as we do now. But there's still a stigma, even though it's more open now. Younger generations, Gen Z, which would be your 13 to 28-year-olds, are much more focused on this. And if you look at apps that are on the app stores that focus on things like tracking habits and mood and journaling and all that, this is a big movement in the last few years, several years. You look at the number of startups in the US that have been built around this concept, and workers do prefer this, right? They do prefer workplaces where there is support for, given the fact that the number of employees that are actually looking for support, whether it's for themselves or their dependent, right? We're not just talking today about the employee, but their whole family unit is actually impacting their ability to be productive. And interestingly enough, and I have all the sources for these stats, but 84% of those that were surveyed a few years ago indicated that workplace contributes to these challenges. Not that it's, it's a toxic, coworker per se, but the stress of work, the money they're making, the time off, the challenges, the commute, those things contribute to mental health issues as well, right? So it's not that people bring in these mental health issues by themselves, but sometimes the experience that they're having with work can contribute to that, and that affects our ability to retain good employees, right? And keep them productive and keep them showing up for work, which is key. So it's not just about their own personal life, but it's how it interacts with our workplace, which we want to be mindful of. And I've had probably, I was thinking about this morning, probably close to 1,000 employees over the last 35 years. And in the early days, in the 90s and early 2000s, you would just never talk about mental health. I mean, it just was not something you, as a manager, you would even bring up or foster a conversation on. And it hasn't really been until the last decade where I think employers are getting trained on how to at least listen and make sure they can redirect employees to the right resources. So from the employees, right, this is driving, and some of these are probably seem very obvious, right? But it does impact burnout, absenteeism, and turnover. I was looking at some stats over the weekend, and on average, about 3 to 4 business days, or 3 to 4 days, employees don't show up for work on average per year relating to mental health issues. Again, maybe it's not themselves, it could be their spouse, could be their dependents, and it affects them showing up. It affects them being productive. It also affects how they interact at work, right? Who hasn't worked with an employee who feels combative or is withdrawn, and you wonder what's going on, and that affects, then has a crossover effect and kind of a spillover effect to the other employees as well, right? So if they're not coming in a good wellness state, that affects the other experiences of other employees around them. So it affects them in satisfaction, engagement. We want good employees to stay, but sometimes good employees, as much as bad employees, have these challenges going on: anxiety, stress. Their child is dealing with something really bad, or their spouse, just lost their parent, and that's creating this ripple effect in the family. So you want them to stay, you want them to perform, be engaged, and without the right tools available to the employees, they're not. They'll a lot of times they'll drop out of work. They'll just take time off, regroup, and then try to come back into the workforce. So it is not something that, as employers, we want to kind of ignore. And not to say that any employers ignore, but we just want to make sure we pay attention. So from my perspective, in speaking about this, and just my own personal background as well as professional, it's not just about the employees. It is a real business issue. It's not just about dollars and cents. It's about our companies performing well. And if you look at things like morale and productivity, as I mentioned, retention, retaining, absenteeism, all those things are impacted often not by how much you're paying them, right? I mean, they always say, like, reason why people stay at jobs is because of their boss, because of the environment they're in. It's not necessarily how much they're making. That is definitely impactful at times, but it's really about their overall ability to perform and the support they feel like they're getting from their employer and their manager. And importantly, the cost, right? So we're all struggling with, I mean, I still trying to figure out like what my tax situation is going to look like over the next year, as we probably all are, with tariffs and things like that, and tax brackets changing, and impacts to employees changing. But the healthcare costs are real. As I mentioned, so many of, and I worked in the emergency room earlier in my career, but so much of the costs of healthcare are driven by hospital stays, emergency room stays. When you show up in the ER, the chance of you going to the inpatient is significantly higher. People just don't show up inpatient. They go to the emergency room and then they stay there. The reason why they show up in an emergency room is because they're often not dealing with things proactively. They're not working through their mental health issues, they're not working through their own self-care, their own wellness, and you wait till it gets too bad, and then they show up. And so those costs impact employers significantly. And so it's not just chronic disease like diabetes. By the way, about half of diabetes folks that have, I'm also on the chairman for the American Diabetes Association in Maryland, but a large percent of those that struggle with chronic conditions like diabetes and heart issues have mental health issues that make it worse, make those costs worse, make the experience worse. So the more as employers we can offer up those services, tools, resources, the better. I put the data point at the bottom because not to necessarily think about the global cost of anything, but it is interesting that $6 trillion it's estimated. In 2010, it was 1 trillion. By 2030, it'll be $6 trillion of productivity costs impacted. This is absenteeism, productivity, et cetera, by mental health issues. So it's hopefully I've underscored the point of why we're here, why we're talking about this, because it does really matter. So why we should care, I mean, again, I kind of underscored a lot of this, but I just think to capture this, that employees look for support, they look for those benefits that are going to help them. We want employees to feel like they're being supported. We're not coddling them, but we're realizing that they're real humans with real experiences at home. And we just have to be, as managers and as leaders and founders or owners of a company, we just have to appreciate that, make sure that we understand that this matters to employees performing well, staying and not moving on to the next company that maybe does provide those support. 60% of employees consider those benefits when they're looking for a job. 66% feel more positive about their employer. What is interesting is that the employees do appreciate those benefits. But it's not that they're always taking advantage of them. And one of the things I looked at in pulling this deck together for the presentation is that I think the number was 38. I wrote it down. 38% of employees will access that need services will actually access them through work. And what's the driver behind that is there's issues of trust. There's a stigma behind it. EAP, I know a lot of employers, most employers that are of a certain size and bigger, have employee assistance programs. EAP has always been, but it continues to be well underutilized as a service because employees, I remember thinking this when I was younger, that if I use that service, my employer is going to know, and it's going to affect my job review and and my ability to climb, so to speak. So those services are that are offered are often underutilized. Engagement is low. As I mentioned earlier, management, it's not something that intuitively companies think of training, having someone come in or otherwise encouraging their managers to be cognizant of this type of information. So if the employers that get this webinar can share it with their team, but understanding that this is an important factor that's affecting their bottom line as well is key. So getting managers to be trained up a little bit on understanding how to make these things available, making a conversation occur, letting employees feel not threatened by talking about these aspects are key. Another aspect, another reason why these current solutions, current wellness initiatives that do exist struggle is just what is the return, right? What is the return on investment for an employer? How do you even measure the impact? And it's really hard. It's hard to measure that. The reason why this one team member is you can just feel that they're not really focused this week, it's because there's something going on with their spouse or something going on with their child. So they are intuitively harder to measure the impact. There are definitely programs. I think when I was maybe it was a Care First or United Healthcare, we were given a web app to go to where we would track our steps for some competitions, and it was like a short-term burst. Everybody did did a whole bunch of steps for like a week, and it ended. And I think the employer felt great; they could check the box, they supported wellness. And but there was really no lasting long-term measurement available for that. So I think that, you know, this is an issue that plagues employers, and when they're thinking about wellness programs, how can they measure the impact? And so there are things you can do, like surveys, looking at surveys over time. There are climate surveys that a lot of companies are doing now to really kind of assess not just the work aspects, but also anonymously understand what is impacting people personally and how they feel supported. The other challenge of a lot of the current wellness programs, and I worked at a self-funded third-party administrator supporting employer benefits for about 6 years, is a lot of the programs are very employer-centric. Like, okay, my employer is giving me this program where I have to do X, Y, and Z for 10 days, and I get something out of it, some reward system. They'll do it, right? Because they want to get their money. They'll log into an app, whatever it is, and they'll do it. And what that becomes a very employer-centric experience. There's no long-term effect in most cases, and it doesn't say make the employee feel like there's real support. They feel like they're checking the box for their employer in some cases. So I think that we have to be thoughtful of, as employers, that are what we're offering, is it going to help them in the long term, and start building in those coping skills, resiliency skills, so when they have a stressor at home, they can deal with it sooner and not carry that into the workplace. So I just wanted to, you know, I've been doing the employer benefit thing. That was the first 15 years of my career, and when I looked at it in the last year or so, it really hasn't changed a whole lot in terms of a lot of the approaches taken. All right, so the second part of this discussion, I'm going to kind of just talk about self-care tools and what does that, you know, what does self-care mean? It's not a concept that a lot of people think about self-care. It's definitely a very popular term in the Gen Z space, the younger generation. It's whether you go on TikTok, which I don't go on, but this concept of taking care of yourself, tracking how you're doing personally, and building off of that and growing is, you know, this concept of self-care. You know, that it starts with our ability to be self-aware and manage ourselves, so we can then, you know, and develop skills around coping and resiliency, so then we can deal with those stressors that do come up. So in the last probably 4 years, certainly COVID was a huge spike in this concept of these self-care apps around, and we were very familiar with things like Calm and Headspace, and there's these apps around meditation and breathing and habit setting. Those apps exploded during COVID because people were struggling. We know what the numbers were abysmal in terms of mental health issues going on at the time, and they haven't gotten a whole lot better. But there definitely was a large burst of those types of self-care apps. And what I am seeing now in the last probably year and a half, because I track all the other, you know, self-care wellness apps out there. There's a whole new breed of apps effectively that started as consumer-centric experiences, meaning it's all about the consumer and it's built around their experiences, and trying to link them to solve employer challenges. And the biggest example of that is Calm, right? Calm is, everyone's familiar with Calm. You know, I think that's, you know, every commercial they have out there. They started really as a consumer-centric experience to help folks, the average person, work on stress, anxiety through different breathing exercises, etc. They then decided to pivot, and they also have $1 billion investment to then work with employers to take that consumer-centric tool and take in those things like wellness challenges that the employers want to launch and other things, and pull it into that consumer experience. So this concept of self-care tools that were really built around, you know, a B2C experience are now moving to more of a B2B2C, meaning they're being sold to businesses to work and help consumers, which is really kind of a novel approach in the last few years. So consumer-centric, accessible. They're not like I don't know if anyone's gotten use an app from their doctor, or for a lot of times from your employers, it feels very healthcare-ish. It's like you're loading your medical record in, or you're doing these other. It's not about you as a person. How are you doing on your wellness journey? So these new apps kind of are taking that position of let's kind of move away from the old school approach and really focus on a consumer, but then align the goals of mental wellness check-ins and reducing anxiety and stress and access to services, make that and align that with the goals of the employer. So the other aspect of a lot of these apps is they work for employees and dependents. The kind of the older school approach was definitely platforms for the employees and contests like walking. I remember at Care for, or maybe it's MAMSI or United Healthcare, it was all about steps of the employees, and you build these teams, but it really wasn't anything focusing on the dependent, which is important. And I think that the other nice part of these apps, not only they're in this person's smartphone, which most platforms are smartphone enabled, but these apps are geared around the individual tracking their own personal progress, whether it's looking at their emotional state over time, looking at their sleep, things like that, and how that's affected their mental health. So I think that journey is much more familiar and natural in a consumer focused platform. So I don't know if there's any questions. I really wanted to focus on the mental wellness challenges, but also to kind of introduce a lot of folks who aren't familiar with self-care tools and self-care apps. Okay, so I'm going to spend just a few minutes. So the company, like I mentioned, Uneo Health is our company. We launched Prosper, like I said, both app stores 2 years ago. And then as we were working with a number of clinics through this large state program across a number of counties, a lot of the clinics and health agencies, hospitals we work with asked, could they roll this out to their employees because they see the impact it's having. So we took Prosper and launched Prosper Well. And so this is just to introduce you to one of the self-care tools that's out there. And this is new for us, not working with people, because we've got, close to 20,000 downloads at this point. But, it's new for us to take those consumer approaches that we've done and the positive impact around stress, anxiety, and providing support, and working with employers to kind of try an innovative approach to impacting kind of those mental and behavioral health issues we discussed. Prosper Well, or Prosper, is there a question? Sorry, I thought I heard one. Prosper is about 60% are not teens, 55% over 30. So it's not, no, I shouldn't say it's both supports anyone over 13. So a lot of teenagers use Prosper, but as you can see, many thousands of people use Prosper are older. In fact, our number one user of Prosper is, I believe, 51. And our number two user is 22. So definitely impacts a lot of different ranges, which is good for employers that have employees that have dependents. They want one app that can support both populations, which I think is key. It's got a consumer-centered design. My entire team, like I said, my son is co-founder. I know Jill's met him before, but all of my team is under 26, I think, at this point. I happen to be slightly older, but they're focused around keeping it simple, engaging, gamified. We do have rewards in the app. Those rewards can easily be tied into employer reward systems as well. And there's analytics and alerts. I was just on a call with Johns Hopkins before this webinar. They've rolled it out to their diabetes clinic, which seems like those that are struggling with diabetes and prediabetes also struggle with mental health issues. So they make sure all of the patients have the alerts turned on, because it helps remind them. And then it's in both app stores. It's free. We don't collect name and address, so there's nothing for us to sell from that aspect. There's no ads, and it's in English and Spanish. We're seeing a significant growth in the number of Spanish language users. And I guess there's a lot of stressors in that community right now, as one could imagine. But if you have Spanish language employees, if there's a lot of businesses that do, This is, we have we work with Centro Hispano de Frederick, the Hispanic organization, affairs organization in Prince George's County. So we have a lot of different organizations that we work with to ensure that we have an app that helps people with their self-awareness, self-management in both languages. One of the things that people worry about is security, privacy. We talked about the employees often feel that they're being monitored by their employer. That's a big barrier to employees accessing things like EAP, employer apps, where most of them you're putting in your employee information. That's a red flag to most employees. They're not going to be. We actually had at one point when we first launched 2 years ago, you had the ability to put in your name, and we yanked that out right away because we realized that people weren't being authentic or honest about how they were feeling. We were surveying our users, and they were afraid of putting their name and saying they felt anxious or stressed, that somehow that was going to make its way to someone else. So having it be private is key when you look at these types of platforms. You have journaling. If you are using Prosper, and this is true for some other apps that are out there as well, but we have a kind of proprietary algorithm that, based off of your check-in, it starts with it checking in on how you feel, you track your emotions. We can then prompt people to get support, extra support, whether it's calling 911 or 988 or resources. We're working with a large clinic network where the clinic is basically prompted as a resource. So this is a good way. If you have an EAP program as an employer, we can, between where it says helplines and breathe, we can insert the EAP as effectively a button they can press to connect with that as well. So we have the ability to recognize when people are in distress through how they're checking in on the app, and then promoting resources to reach them at that point, instead of waiting till they go to the emergency room. And we know how that affects our costs as employers. And I think that's the main focus. So everything's encrypted and secure. That's key for people. I think just not having to enter your name and address is important. When they join an employer group, they're going to the group section, they're joining, they're putting in an employer code, but they're not putting their employee ID number. The second you ask them to put in their employee ID number or their information, any sense of them honestly working themselves is lost, right? Because we just don't trust intuitively our employers, implicitly, I should say, infinitely. We don't, and so. And how many times you go to a doctor and say how many glasses of alcohol have you had in a week? And generally speaking, people will say 1 to 2. And we just people will not be honest with themselves when it's put out there. If they can be private and work on themselves and make meaningful differences, but still be part of a private group for employer where they can get messaging from the employer, you can get the analytics, the insights of how the population is doing, but not identified is key. So from our perspective, taking what we've done with the state of Maryland, with the school systems, with parent groups, with clinics, and rolling that out and extending it to employers where there's the self-care resource for the employees and dependents. Anyone that joins your private group in the app, you're getting the analytics and insights about how that population is doing. It can help you as an employer, create programming and training for your employees that can help your employee base better, or navigating the resources maybe they're not aware of. There's a 63% of employees don't understand what wellness services their employers offer. I think it was a number from the Surgeon General, but this can help you promote resources that you're already paying for through your insurance company or through your broker, and understand where those gaps are in your employee base. And in the messaging, like I mentioned, when you join a private group, you have the ability to push out messaging, or we can do it on your behalf, whether it's resources, benefits that are available, or other programs within the employer. And I just have a couple of slides left. I mentioned the app. We've got close to 20,000. We're getting to 20,000 downloads. It's it's performing well. I mean, the good thing or bad thing, depending on how you look at it, double-edged sword, is there's no transparent. It's full transparency, right? You can go to the App Store and see exactly what people think about an app. So, and between Apple and Google, we're getting a lot of great feedback. In general, it's always positive. But we will continue to advance Prosper. We're looking, in this space, we believe that since we built such a strong platform with high satisfaction rates, as you can see, over half of people that download Prosper use it all the time, which is good. It's far better than almost any wellness app you could think of in a general space. So there's something simple and yet elegant about how Prosper is built by my team full of young kids and college kids, that it makes it enjoyable and yet still impactful. And so we think that will have a similar effect on employers. These are quotes that were taken from the App Store. We also do surveys for employers, as we do for clinics and for other partners. We can push out surveys. I think it's for the one state program that we've done where we've got 3,000 teens and parents using Prosper. Over 80% have completed the survey, which is amazing to have a survey and have that high, and it's not like they're being penalized by their employer for not doing it. They're doing it on their own. But if you have specific questions that you want to float out to your employees relating to their wellness, and get those anonymized but important insights, that's easy enough for us to do, as we do in-app surveys all the time to subsets. And this is true for kind of any of the wellness apps that are in the employer space. There's not a whole lot yet. I think this is a kind of emerging trend, which is consumer apps moving into employer space. But I do think bridging the two is a nice trend. But like I said, chronic conditions, diabetes, heart issues, all those things have a crossover with mental health issues. They play on themselves. So provide support for both. Having a platform that works for the employee that's an adult, and if they have children or spouse, that it works for both. Consumer centric, I think, is key. I mean, I've used so many apps as an employee over the years, and platforms, web platforms. So keep it consumer centric, simple. This will help employers, we believe, with their goals around retention, productivity, morale. We also, like I said, can tie in with EAP, promote, others. If you have a telehealth program offered through your insurance company or through your broker, is key, but also the insights, right? On having the ability to have online dashboards about how your employee base is feeling about themselves and their own journey is key. And it can help you build the right programming and training for your staff. So I think I hit on the main points. I know we only have about 10 or 15 minutes left, but I wanted to just kind of, hopefully you feel like you get a good primer on mental health and how it ties in with everything else that relates to employees performing well for us as employers, and keeping an eye on that, making sure our staff are trained, our management is trained, having the right tools available, is going to be key. And we think that Prosper is a good part of that. And I think, just to wrap it up from my perspective, didn't want to make this at all a sales discussion. We're new in this space, but the app has, like I said, many thousands of users and has really shown a positive impact. From our perspective, we think this would be a simple way, a very light and very affordable way, frankly, for employers to just have a simple license with us, roll it out. They can get their private group, they get the analytics, they can push messaging, which is above and beyond what the free version online has. And also we're looking for early adopters at this point, right? We've got a few employers right now that we're working through with, and some clinics that have already rolled this out. Prince George's County Public School System rolled it out to all their employees in the spring. So we're looking for early adopters where we can offer a trial, and we'll work through any pricing, because we want the experience, we want to learn. And we know technically we can connect to any of the existing platforms that other insurance companies have, because that's my background, and we've built a number of APIs already. So that was really the goal today, is to, if folks are interested, to reach out to me afterwards. And hopefully you feel like you learn a little bit more as a primer, at least a refresher on the impact of mental health, the employees, their dependents, and kind of things that we should be thinking about as employers, especially given our current climate out there. And that is it for my presentation, Mark.
All right, no, that
Questions?
was good. You covered a wide landscape and provided a lot of good background, and seeing how a current day tool can be implemented by a large or small employer is pretty cool. So let's have some dialogue. Who's got some questions or some thoughts for Eric?
Hey Eric, it's Brooke. Thank you. That was very informative. I'm interested in the age range. I know you mentioned 30. I think it was age 30 and up. So how does that
Yeah.
break down, I guess, in terms of mental wellness? Because in my view, that really ranges. So a lot of people that might be a little bit older that are taking care of their older parents. I'm interested in how that breaks down in that age range usage of technology to help with mental wellness.
Yeah, so Prosper, like I said, it's on, you could go to Apple or Google, just type in Prosper self-care and you'd see the app. It's you have to be over 13, age 13 and older. Like I said, about 60% of our, or 40% of our users are Gen Z, the other 60% are millennial, Gen X. And we actually have 4.5% of our users are baby boomers, so age 62 and older. We see the same usage rate, meaning the 40 to 50% use Prosper all the time when introduced to it, not as a, from their clinician, but like literally we'll set a table up at a wellness event and people just walk by, we'll give them some free merch, they'll download the app. We know that close to 40 to 50% of those people will keep using Prosper. And it doesn't seem to vary by age. Like I said, our number one user is 51, I believe. And then number two is like 22. We peak at 31 and a half. We actually mapped out all the users by age because we collect date of birth. We have to by federal law make sure that they're over 13. And then so we can look at that and understand utilization. Doesn't really change by age, which is good. Our highest users are spread across all the ages, which I think is important for employers offering this up as a tool for their employees, knowing that they have, the employee, especially like my age in the 50s, we have parents that we're dealing with.
Yep.
Right. We have, we also have kids in their teens or early 20s. And so that sandwich generation, I guess.
Correct. Exactly. That was exactly my question. Thank you for answering that.
A question about like,
sure, Ben.
am I able to, like, if I was going to a therapist, am I able to share the information in my app, or like, are they able to see like what I've been putting in there journaling, or how I've been doing, I guess, over time?
Yeah, Ben, great question. So we actually have, we just signed a contract with I guess the nation's largest clinic network. And currently the way it's set up today, in fact, the number one user who we actually interviewed, because we're like, who has used Prosper 600 times? He is in therapy, has been in for a long time. Every time he goes to see his therapist or counselor, he shows the analytics that are in the app. So there's an analytics tab and you show the trends, and because he doesn't always remember how he felt last week, but there's like a calendar view, you can see like the sad face, for click on that and it can see what he was thinking at the time. And that's how he shares it with his counselor. When we finish this, the implementation with this large clinic network, we're going to make it where you can just press a button to share. It's a simple feature, right? Share, and it'll take a kind of a summary view of the analytics that it can share. Well, that's easy, but frankly, right now, like most of our users that are also seeing a counselor, they just show the app when they're meeting with the counselor.
Gotcha. And then another question that popped up in my head while you're going through
Sure.
everything, like with that analytics page for, like, if I was running a company and got that information, like, do you guys help them understand what they should change or what they should offer to improve those numbers with their employees, with your like medical background and all that stuff?
Yeah. So I have a healthcare business background, I would say. So, I mean, I was in charge of insights and analytics at Care First and stuff. So I would not classify myself as a clinician. We do have a great scientific advisory board, I'll give you an example, Ben. We produced a number of reports for the state of Maryland. We've got thousands of teens and their parents and school staff using Prosper across 3 counties right now. And we provide them the analytics, the dashboards, of a million ways to Sunday, all de-identified and aggregated. But we also provide them, to your point, an insights page about what does this mean and things that they can do. That comes from our team. We have, like I said, we have a scientific advisory board. I basically shared the analytics. We had a 30-minute call. They gave some ideas, and we summarized that for the state of Maryland as well as for the counties. As we grow, we'll probably have that as a dedicated position or role. I certainly have a lot of background in these programs, just given my roles at Inovalon and Care First, United Healthcare, et cetera, et cetera. But yeah, it's not just like tossing data over the fence and saying good luck. I think it's, hey, in our experience, in my experience, this is things you could think about, things you could do.
Yeah, that's good, because like data's cool and all, but if you don't know what to do with it, it means nothing.
Right. Yeah. So I totally agree. Good
Thank you.
question.
I have a question kind of with Ben's question.
Mhm.
In sharing. So you said 13, so I've got 2 teenagers that are, well, yeah, almost 13 and 16.
Mhm.
How is there any way, like, could I, if they're doing the app, like, can I see it or unless is it just they have to show it to me, or is there any way, since they're a minor, that I could see it, or will it notify me? Is there any like, oh, there's a red flag here? Any like,
Yeah.
no,
Yeah,
okay.
no, it's entirely private. Yeah, and in fact, I presented to the Maryland Department of Health. They had a youth suicide prevention summit. And I was one of their guest speakers, and that question came up by one of the people. Oh, it's a great question, right? We're all parents. We get so anxious. I had to turn off my locator on my kids' phones because it would just freak me out all night long. If we firmly believe that if teens think that what they're doing, what they're saying in the app is in any way will make its way back to the school or make its way back to their parents, that they're not going to genuinely work on themselves. That being said, they have always had the ability to share how they're doing with their parents by just, like I said, same model as a counselor, show how they're working if the parents know that they're using Prosper. The other side of it is if they're having bad experiences, they're feeling awful, bad, anxious, stress, we're promoting those resources like 988, 911, other self-care resources as well. So we want to keep it private. I think that was the head of the Department of Behavioral Health in Maryland stood up and said, we've got to keep it private, but also make it that safety factor, which is let them know, hey, here's a resource for you. But as a parent, I mean, I guess it's going to be up to the parent to have their child share it with them, because we just know that they won't use it. They will feel like one of the things that our relationship to work with the school systems, we basically said we can not say this is a school system app, because the kids believe that everything they do in a school system is monitored, and say they won't be honest and they won't really work on themselves. So it's a tough thing, Amy. I mean, honestly, as a parent, it's tough, but we also know that we want them to work on themselves genuinely and authentically. And hopefully parents are having those conversations and understanding and they can share with them.
I downloaded it while I was on the call, so I've been playing with it.
All right.
You're on your road to 21,000 now.
I'm
there you go.
Yeah, that's right. You got 20,001. I'm setting my daily habits right now.
All
Declutter
right.
your space. I like that one. I clicked that one. I need to do that once a day.
So Eric,
Appreciate
shifting gears just a
Yeah.
little bit. This app is, and you talked about the different, apps that have been out there. Sean had an interesting question about the business model and how you're doing, and maybe Sean, maybe you want to share your question a little bit and see what Eric has to say about it.
Yeah, sorry, I wasn't sure if this was the appropriate place to ask this, but could you talk about your business model, how you're measuring success? I assume it's app downloads, but there may be other things. And what are your 1 year, 3 year, 5 year goals? And are you looking ahead to next steps with upgrades and future apps, things like that?
Yeah, Sean, so couple of questions in there that I think they're all really good ones. One is for us as effectively a B2B2C company, right? Because we're not monetizing the data. We're not charging any kind of license or monthly fees for users at this point. Doesn't mean that my son who's very much focused as a B2C, young entrepreneur, but we're a B2B2C. So we license it, Prosper, to, like I said, the state of Maryland, to these clinics and to employers. That is our measure of success. Honestly, though, is I will never be successful in licensing Prosper to the B, right, to a business, if I can't make it a powerful, successful tool to the consumer. So when we started the company, my son was back from NYU and during COVID, and I was like, look, you build me the best, I'm sure I use an expletive app you can, that consumers will use, and I will figure out a way to license it. Because to me, I just wanted to get help out there. So our measures of success are around our retention rate, usability. These are numbers I report to state what percent are using the app, 5 times, 20 times, 50 times. Satisfaction, like I mentioned, all the in-app surveys we do, so we track satisfaction. I look at our online reports every single day, insanely so. So that was your first question. The other part is I see Prosper as basically a ubiquitously applied tool across a lot of these, I wouldn't say Swiss Army knife of self-care, but we can be applied into any number of programs across the country. We actually are going after a couple of other initiatives across it, one in Michigan, another one in Maryland, that just they need a consumer-friendly tool that can help people, but then they get the insights. And so we see Prosper as fitting into any one of those, thousands of programs across the US. There's so many employers that could use a very simple, affordable, a couple of bucks a month per employee type tool that can help them. And we can drop into any one of those things because the app is so simple to use, and we're always evolving it. That was your last question, is we have plans for a whole nother gamification system that will launch this summer with my son Alden, and he's got a team of UI UX people. That's a great question, Sean. Hopefully I answered it.
I think with the competitive nature of the space and the demand or the need for it too, having a well thought out and sustainable business model will keep this going. And what will keep the business model going is additional users. So it's a matter of kind of pushing it out there and working it along.
Exactly.
Anybody else have any questions?
Just a quick question on, I know you said small teams get the trial. What is your barrier for what you determine as a small team?
Oh, in terms of like number of employees that you're, yeah. I mean, I don't think there's a bottom line at this stage for us. We want to, we'll work with any size employer at the moment. I think our financial and business model will be targeting kind of the 20 to 200 space over time, right? But right now we're looking for employers of almost any size, probably more than 5 or more at least, I'm sure. But to learn and make sure that we're, we can pick up on any employer specific nuances that we hadn't thought about. We're an employer as well, but I think there's no real necessary, bottom line at the moment for us.
Cool. Good to know, just in case I'm talking to people while I'm out and about.
Yeah, appreciate it. And Mark, thank you I'll send this deck to the team. I know we're kind of on time, but great questions. I'll send you the deck to share, and appreciate folks giving me their time on a Tuesday morning.
All right, no, great. Thank you, Eric. You did a great job, and you definitely fit the bill of like moving forward and getting it all done in an hour, and providing some information that's wildly timely and hopefully can get plugged in to some of our member businesses.
Great, thank you.
All right, great. Well, thanks again, and everybody have a good day after Cinco de Mayo.
That's right. See you. Bye-bye.
All right.